Well, good morning, everybody. This is Keith with Positively Osceola here for a Daybreak Live, and we see some great folks joining us, and we've had some great discussions over the last few years. But certainly today, Dr. Luis Herrera is, I'm going to say, going to be one of the most special ones because it's about life and health and so many great things. We'll keep the official welcome in a few seconds. But how are you doing this morning, sir?
I'm doing well, Keith. Thank you for having me.
Well, it's an honor to have you here, sir, and so happy Tuesday. We're going to try to expedite the front end of this because typically we'll start out talking a little while, but going to make that a little brief this morning because we know that you are an extremely busy man, and we don't know what you might get a call right in the middle of this, and that'll be the deal. So we're going to make this official, and we'll start off by showing some more coffee. Well, it is official. So again, welcome, Dr. Herrera. I guess I'd start off by saying November is, as we were speaking, Lung Cancer Awareness Month. And according to the American Lung Association, lung cancer is the #1 cancer killer of men and women in America. And so today, we really appreciate that you would take a few moments to speak to us. And hopefully somebody hears some of this information and that is important that they did. So today, a very special guest again. This is Dr. Luis Herrera, thoracic surgeon. Is the medical director of Rod Taylor Thoracic Care Center at Orlando Health, UF Health Cancer Center. He's a member of the Thoracic Head and Neck Cancers Specialty Section. He joined Orlando Health UF Health Cancer Center from the University of Texas MD Anderson Cancer Center in Houston, where he served as Chief Resident of Thoracic Surgery and is currently appointed as an adjunct assistant professor of surgery in the Department of Thoracic Surgery. Please join Positively Osceola in welcoming Dr. Luis Herrera. That is a lot.
Yes, thank you, Keith. You handled it very well.
It was a lot, but that's because you do a lot. So again, to be respectful of your time, and certainly we thank Orlando Health as well as everybody who took to schedule this today. So we'll just get right at it, I guess. So according to the American Lung Association, lung cancer is the #1, like I said, cancer killer of women and men in the U.S. But I believe that could come to as a surprise to some people. I think sometimes, if that's the case. So why would it be a surprise? Do you think it's still something that seems not as publicized as October's Breast Cancer Month?
Absolutely right. When people think of cancer, they think of the more familiar or advertised awareness campaigns like breast cancer awareness, prostate cancer for men. And there's certainly a lot of importance in any cancer, of course, because they're all serious. But lung cancer kind of takes a little bit of a backstage. It doesn't get as much of attention. There's a lot of biases, meaning that people think, oh, lung cancer is only for smokers, and it's not that common. But the reality is the second most common cancer in the US. So for both men and women, lung cancer is the second most common type. Women, the first one is breast, followed by lung. And for men, it's prostate, followed by lung. The serious part of it is that even though it's the second most common, it's the #1 cause of cancer death for both men and women. So unfortunately, a lot of people are not aware of that. They think, oh, for women is breast cancer, and it does take a lot of lives and affects a lot of women for certain. But lung cancer is just as important, if not more.
And so we may just assume that we know what the answer to this is. But so what is the main cause of lung cancer?
Mm-hmm. Without a doubt, the #1 risk factor for lung cancer is smoking history, or being active or current smokers. However, 20% of our lung cancer patients have never touched a cigarette. That's 20%. 1 of 5 had never been exposed or smoked themselves. So it's shocking to our patients when they're diagnosed and they're healthy, they're They have healthy lifestyles. They avoid any bad habits or exposures. But it is the reality that this disease can have other risk factors that can make it develop.
So do you see that as a combination of external scenarios like maybe unhealthy air, secondhand smoke, or do you see it, or is it still a puzzle and you attribute it to maybe a hereditary scenario?
Definitely, you're absolutely right. It's a little bit of both, and we don't understand the non-smoking risk factors as clear as the smokers' risk for lung cancer. But certainly, environmental exposures. There's radon, which is an inert gas in our environment. Overall pollution, secondhand smoke, and definitely there's a genetic component, not necessarily hereditary, but there's damage in our genetic machine that sometimes cannot be repaired and can lead to a lung cancer.
So I don't know that we've had a discussion in the last 7 or 8 months that doesn't have the word COVID in it. So of course this one will as well. So how has COVID-19, the pandemic, how's that affected how you diagnose and see patients and treat patients? How has that changed since March?
Yeah, so COVID obviously has kept the healthcare system very busy and displaced some important disease patients with important diseases. So the main thing that we're seeing is patients getting less imaging studies. They don't want to go to the doctor. Perhaps they're a little apprehensive about stepping out of the home, which I completely understand. But to that end, they're not getting their usual x-rays. They're not getting their usual tests, which often diagnoses or detects lung nodules, which many of those sometimes could be cancers, right? So the other thing is that it has decreased the utilization of lung cancer screening. We use a CT scan to screen for lung cancer in patients with a higher risk factor, such as smokers. So because of COVID, people are less able or willing to go through those routine preventative tests.
I know we spoke a few minutes earlier. So you're certainly going to have people who are hyper responsible or have a system of how they're going to approach well care and health in that manner. But what triggers somebody? What are those symptoms that somebody might see that should alert them to a chance of something not being right, and then say, look, maybe I should get a screening. This is something I'm not sure of.
Mm-hmm. Well, lung cancer, the reason why it's so deadly, unfortunately, is that it's mostly diagnosed at late stages, diagnosed at stage 3 or 4.
Right.
85% of patients with lung cancer have no symptoms, zero. Only 15% present with the symptoms, such as a cough, coughing up blood, weight loss. But by the time someone gets symptoms, it's usually late. So the only way to diagnose lung cancer early, stage 1, when it's potentially curable, is by accident, meaning you had an X-ray because you're going to have your shoulder surgery and the X-ray found a spot in your lung, and that leads to a workup that hopefully, if it is cancer, it can be picked up very early. And the other way to diagnose patients without symptoms is lung cancer screening. That means for patients age 50 or above who has smoked a pack of cigarettes for 20 to 30 years, they could be eligible for lung cancer screening. It's a non-invasive CT scan of the chest looking for lung nodules in your lungs.
Right.
It's harmless, it's safe, and it is approved by most insurance as well as Medicare. So it's something that unfortunately is underutilized, but it can save many lives.
So I'm kind of on the same track as that. So how does treatment of lung cancer in 2020 differ from the past, maybe 10, 15 years ago? And I think another challenge is if it's not a part of your life as a patient, you don't know, you're fairly ignorant to how that all works. So what's different now than maybe in the past a bit?
There's been tremendous advances in lung cancer treatment overall. So if you look at the overall survival for lung cancer, it has improved significantly over the last 20, 30 years, and mostly due to advances in surgical treatment, which is what I do, radiation, and a lot of advances in chemotherapy slash systemic therapy, we call it, but basically is the move of immunotherapy, meaning using the patient's own immune system to attack the cancer with specialized medications. So because of that, the survival has improved, but the best treatment is designed based on the stage of the disease. So if it's diagnosed early, the best treatment is surgery.
Right.
What's different now than 20 years ago is that we do these operations robotically with small incisions, as opposed to opening the rib cage. So patients can go home the next day and recover much quicker. And then you talk about radiation, which is miles ahead as the technology that was 20 years ago with
Sure.
more focused treatments. And then the chemotherapy or systemic therapy or immunotherapy we talked about.
I know my mother, I won't go on to the long story. This, my mother had a bit of colon cancer a number of years. She's 89 now and
Oh, wow.
healthy. And it ended up moving to her lung. And at that point, they did not have the robotic surgery capabilities. And so she went through the whole scenario as they did then. But they did very well for her. So she's
That's great.
still doing great. I guess I would like to hear what you'd say. So with the emergence of vaping and e-cigarettes is that causing concern with the possibility of increase of lung cancer for young adults or other similar conditions caused by that? Are you seeing that problem?
We don't have any direct evidence because it's too early to know,
Right.
but knowing that vaping causes inflammation of the lung and damage to the lung and scarring on the lung, and knowing that whenever you have inflammation in your lung or damage or injury to the lung, on that repair process, something can go wrong and lead into a cancer. So
Right.
I'm very concerned that in the future, in the next 10, 20 years, we're going to see a big increase in the number of lung cancers in people who did not smoke traditional cigarettes, but perhaps they were exposed to heavy vaping use.
So, and that's certainly concern. I mean, there are just enormous amounts of concerns related to that. So we would be here for 40 minutes to be able to talk about
Yeah,
all that for sure.
yeah.
But we'll respect your time again. So could you say that, could you, Orlando Health, could you say that life expectancy has improved with the treatments that are currently in place with lung cancer?
Absolutely. We've almost doubled the overall life expectancy for somebody diagnosed today with lung cancer compared to 20 years ago. Um, Early stage lung cancer can be cured, 95% probability of being cured if you're diagnosed at the earliest stage, stage 1A1. But the more you move along that stage spectrum, the risk of not surviving is higher. So the key is early detection. If you have any symptom, speak to your doctor to get an X-ray or a CT scan of your chest if you're high risk. And if you have no symptoms but you are high risk, talk to your primary care doctor about getting a lung cancer CT screening because it can save your life.
Well said. So I think I'm going to know the answer to this next question, and we're almost at that point. So what can the average person do? What can I do, or what can the average person do now to reduce the risk of lung cancer?
The most immediate impact would be in those patients who smoke to quit as soon as possible.
Right.
There's resources through the American Lung Association, Tobacco Free Florida, that can help because it is not easy to quit smoking, and I understand that. We deal with that every day with our patients.
Sure.
But it can dramatically reduce your risk of lung cancer and other lung diseases. Having a healthy lifestyle of moderation in addition to that helps. Maintaining a normal weight or close to normal, exercising, eating right. I think that's all we can do, honestly, to reduce our risk. And those people who are higher risk already and that have had a history of exposure, then being vigilant about their health and their lungs with screening, as we discussed.
Well, if there's anything else you'd want to share, like I said, I promised that we would get you back to your schedule this morning. Is there anything else you'd like to share with the community with regard to lung cancer awareness and prevention?
My only other advice is that we deal a lot with the concern of lung cancer in patients who've had a lung nodule found, because oftentimes a lung nodule was detected on an X-ray, a spot in the lung, and it can be very confusing to patients and create a lot of anxiety about how to diagnose that. Is this something that needs to be biopsied? Is this something that just needs to be monitored? And just to make sure that you have a team that has all the tools available to get to the answer will save time, will save the risk of having unnecessary procedures. So consult with your doctor to have a dedicated lung cancer expert evaluate you in case there's a concern.
Well said. Super. We really appreciate your time. We are honored to have you here today, and we appreciate Orlando Health making that possible for us. I would say any more questions that people who may heard this have about lung cancer prevention, treatment, everything related to that, certainly can go to orlandohealth.com. And I would say choose Orlando Health, right? And so, Dr. Herrera, we appreciate you very much, sir. And I hope that you'll have a great day and a super holiday season, and be safe and well, sir.
Likewise, it was an honor to be here, and thank you for having me on your show.
The honor was ours. Again, this is Keith with Positively Osceola, along with Dr. Luis Herrera from Orlando Health, together making a positive difference in and around Osceola County. Have a great day, sir.
Thank you. You too.